So this is actually a public funded digital health technology project starting in 2010. So we're actually over a decade long. So that the program has been going the process of science, technology, engineering, and the data. Is that right? Leading to clinical trials. So it's a typical STEM project. We started with the overall an animal model. Okay, an animal model in which we show that actually human brains, animal brains, same. They can use auditory cues, okay, to facilitate and also to reduce the error of a planned movement, okay? So for Parkinson's disease, why it is so relevant? Because in Parkinson's disease, we know if you give patients some prompt or cues, they will do better, okay? So we also has a very specific animal model about this cueing network. Is in animals is connecting the parts of the music perception area to the gait area. Okay, back to 10 years ago, it's not very clear the specific circuits, but now we do have a very particular knowledge on the circuitry. So that all started there, and then we developed a sensor. Okay, initially it's using the iPod Touch. And then it's migrated to the external high precision ambulosensor to give you like a 10 times more accuracy, okay? And then the design of this training is based on three components. Number one is goal-directed step size, okay? The patients will have to walk with a defined the size of the step, okay? Then the music will play. Okay, so it's a thresholding mechanism. The second component is a music stimulation. So because we all know the music stimulation leading to a dopamine release as well as many manifestations, okay, behavioral manifestations in motor domain, memory, cognition, and etc. So there's many direct music lead changes in the brain. The last component is the aerobic exercise, because by setting up a step size threshold, by the way, which is the most significant motor deficit in Parkinsonian gait, okay? So if their step size can increase 10% of their current level, they will not freeze, okay? But anyway, by defining the step size and by establishing an online remote monitoring system, now we can prescribe precisely the dosing of the exercise. Okay, so as you can see, this is a multi-domain intervention. It doesn't rely on a single component. So that is why we think many of our patients love the program, and also there's clear clinical benefits in terms of like UPDRS score part 3. Not only there's a short-term benefits in terms of overcoming freezing, but there's a mid and long-term benefits lasting over 2 years. So this is what as we reported in the 2 abstracts. Okay, so the first abstract is really about how this technology can be used for diagnosing different subtypes of freezing of gait. Okay, this is a long-lasting challenge for the entire Parkinson neurology research, because you do not see many patients freeze in the clinic. So if they don't freeze, you can't examine them, and then you can't develop treatment. Is that right? So this is a obstacle. Everybody recognize it. So now we use this device, okay, use Ambulosono device. We can actually record using a dual task to induce freezing. Okay, they have identical form as the naturally occurring freezing. Okay, in over 90% patients. Okay, so basically what we report in that abstract is that if you ask your patient saying, okay, have you ever experienced the freezing, okay, in the past 6 months or a year? If they say yes, you bring them to the hospital. Before that will be an end of story, okay? People say they have freeze, but I have no idea whether they freeze, when they freeze, and under what condition. But now, once they come to our clinic, we can actually just let them do a dual task, like say carrying a glass of water or walk, back subtraction like 7 from 100, etc. Over 90% patients will show they freeze right in the clinic, okay? And it doesn't require specific equipment, just, iPod or iPhone, okay? So we can see everything. So that was the first thing. Once we have this technology, we can consistently, reliably measure and demonstrate freezing. So we developed this treatment protocol, okay? So right after they show the freezing, they were put on the Ambulosono device, let them walk in the hospital for half an hour, okay? So it turns out when this patient come back, they don't freeze anymore. Okay, so, but this phenomenon is called a paradoxical movement that has been recognized many years ago by Oliver Sacks. He was the first one to describe that music has this peculiar, but it's nevertheless it's a dramatic influence on agnesia, freezing. So, but now we have not only reproduced this anecdotal observation, but transform it into a therapeutical method, okay? Following that, actually, then we ask whether if you let patients use this Ambulosono treatment in the midterm and longer term, like say around 6 months and 12 months and above. And then we use the UPDR's score to see whether there's long-term changes. So it turned out it's not only a changes, it seems like it reversed the normal trend of increasing UPDR score, but now the patients actually see a reduction over a long period of time. So we're currently working on a robot, okay? So the human will not only train with a physiotherapist, they will train with a robot, okay? So the robot will learn what is the best testing or therapeutical approach to these patients. And the robot will become very creative. It will generate a piece of music, okay? That may be lousy for a human being, for us to enjoy, but it works perfect for that patient. I think digital health technology will know, like what we're doing is a second generation, okay? The first generation is something like, iWatch or Fitbits, they just tracking and monitoring your walking steps. But in our view, the real catch for the digital health technology is you bring those medically established tests. For example, we're doing the 6 minutes walking test, completely digitized. It will substantially reduce the cost and increase accessibility to all the populations. Medically established tests without wearable device or digital technology will be very difficult to provide to patients. They charge $200 per test. Now we're doing it essentially for free. Okay. And secondly is the interventions. Before, it's impossible. The Parkinson patients, they can be sent to a music therapist, exercise therapist, rehab therapist, but it's not sustainable. No, it's very costly. But now we merged all three into one single intervention using the wearable device.